Hello everybody. Welcome to No1doctor channel. Today we will talk about one of the famous doctors, Sir James Paget, 1814 to 1899. Paget's disease of the nipple, bone and penis, osteitis dissecans, spontaneous thrombosis of the axillary vein. Sir James Paget was a remarkable clinical observer and surgical pathologist, who described a whole series of clinical entities. He is best remembered by his description of what he termed osteitis deformans, in 1877. One patient, observed over 22 years and finally dying of neoplastic change in the left radius, is described in great detail, including an autopsy report. He refers to 4 other patients of his own and to previous reports of 3 other cases, one by Sir Samuel Wilkes of Guy's Hospital. This common disease, still of unknown etiology, is usually referred to as Paget's disease of bone. In 1874 Paget described 15 cases of a disease of the mammary areola preceding cancer of the mammary gland, now often referred to as Paget's disease of the nipple. A similar condition of the penis is usually entitled the erythroplasia of Querat. Several other lesions, previously unrecognized, were documented by this great clinical observer. James Paget was born in Great Yarmouth in 1814. His father was a wealthy brewer and ship owner, whose businesses failed when James was 13. For many years James suffered penury and labored diligently to pay off his father's debts. At the age of 17, young Paget was apprenticed to the local apothecary. In his leisure time, James, together with one of his brothers, wrote an extensive study of the flora and fauna of the local countryside. In 1834, Paget entered St. Bartholomew's Hospital as a medical student. In his first year he made his first original discovery. He described the worm Trichinella spiralis as the cause of the curious bony spicules which could be observed in the muscles of cadavers in the dissecting room. Paget qualified Mrcs in 1836, having gained most of the prizes available in the medical school. For the next few years, with no private means, he worked as sub-editor of the Medical Gazette, lectured in pathology, was curator of the Pathology Museum at Barts, for which he produced an extensive catalogue, and carried on a minuscule surgical practice. Finally, in 1847 he was appointed assistant surgeon at St. Bartholomew's at the age of 33. He was made full surgeon in 1861. Once on the staff at Barts, Paget rapidly built up an enormous private practice based not on his surgical expertise, but on his superb knowledge of clinical medicine and pathology. His advice was widely sought about rare and difficult surgical problems. An average working day would be 16 hours long, and there were frequent long journeys by train to see patients in distant parts of the country, as well as calls overseas. He was surgeon to Queen Victoria for 41 years, and to Edward the Prince of Wales for 36 years. James Paget served on the Council of the Royal College of Surgeons, and was its president in 1871, the year he was appointed a baronet and the year also when he retired from active surgical practice, although continuing to see patients for many more years. He died just before the new century, on the 30th of December 1899. Thanks for watching. Hope to see you again in more next videos. With my best wishes. Dr. 8 Fomid.